because it's going to be a workshop, an interactive workshop. Can I request the participants to switch on the video as well, at least in the beginning? Good evening, everyone. Hi, Brown. I can see you.
Hello. Hi there.
I'm going to talk. I mean, I hope we have quite an interactive discussion on help seeking and management for mental health in this workshop. I think we have the next around 30 minutes that we can use to discuss pertinent points about help seeking and management. Um, I'll just start sharing some slides and I'll stop in between to encourage some discussion. I would request, if you cannot put on your video, at least put your thoughts on the chat box so that we can raise them and discuss. And if you want to even speak, do unmute yourself and you can bring in your points as well when we go further into the presentation. The main theme that we are going to speak about today is about help seeking and management, and just going to raise a few points which are useful to know and useful to discuss as well. And as we have seen in the discussions earlier, I hope all of you had attended to the inaugural addresses and the speakers about the project as well. And we have learned and we have noticed also how the burden of mental illness is so much, chronic mental disease burden is so much, and the treatment gap, especially in lower middle income countries like India, is so high, up to 80%, and people still find it hard to seek for help seeking. So to go and seek help for mental um, health care, there are a lot of factors which we know is involved in, which are like barriers to help seeking. We'll just discuss about a few. I'll just bring in one of the common scenes that we see in the community. I work in the community a lot. So, this is one common example that we see in the community. This is a young girl, a 17-year-old girl. She was noticed to be withdrawn and showing odd behaviors for the last 6 months. And the neighbors keep pushing them to be taken to the local healers in a temple. This is one main point, that the neighbors are telling them, take them to the temple. And some other contacts ask them to leave her in a home in another district run by nuns, so that people do not know that she's got a odd behavior. The family is isolated and not invited for social events, and a relative living in the city instructs them to take them to a counselor. I want all of you to spend a few minutes on this scene that we see very commonly. So I have raised a few points in this scene, and I would like you all to bring up. I'll just hold on to the slide for a minute and then go on to the next slide. So you can see that there's a young girl showing odd behaviors, neighbors pushing them to take to local healers, some people asking them to live in a home, where usually people are sometimes abandoned by families. And then somebody is asking them to take them to a counselor. And you can see that I put counselor in inverted commas. So what could be, I'm inviting thoughts from all of you about the factors that has led to this scene and the challenges these people face. I'm going to stop sharing now so that we can chat for the next uh, some minutes on this.
I just unmuted myself. I think one of the things that strikes me from the scenario you've just shared with us is the way that there are a whole variety of different influences on people's
Yes.
choice of course of action,
Yes.
choice of treatment options. There's the spiritual and traditional healing options. There's what you might call the psychotherapeutic option.
Yes.
There's the, I suppose you might call it the sequestration option. Send her away to live in a home with nuns a long way away where nobody knows. And the other thing that strikes me from that scenario is maybe the family are having social difficulties as well. Maybe it's not just the individual in question, but if people aren't able, the family members aren't able to engage in social events like everybody else, are they facing some troubles with social interaction and with managing friendships and relationships with others too. Um,
Very good points, Brown. I mean,
mm,
you rightly pointed out what I've raised in terms of how an average family in the community in a rural part of India can face trouble when somebody in their family shows symptoms of mental illness. Like you rightly said, there are so many options which people suggest, but still there is no understanding about where to go and how to go about it. And they are
mm,
also, because of other social determinants in the society, especially stigma that Radhika has really pointed out, that stigma, the parents have concern and the family is isolated because of stigma. Uh, the stigma is both, it's self-perceived as well, because this understanding about mental illness is so entrenched in the society that it is not like other illnesses. A family has a physical illness, they immediately rush to the hospital, isn't it? They don't have a second thought about it. But when it's a behavioral issue, they immediately withdraw and they kind of chew on it. They kind of spend so much time on it, thinking it's our responsibility. It is the person's responsibility. It's the person's fault. It is their blame. They have done something wrong. There is some curse on the family. So there's so many beliefs that has been imposed by centuries of beliefs by the society as well. And so that also influences how they seek for help. Because, and when I meant, like, I can see somebody ask, Ketaki asking, where their counselors available where they reside. I also want to bring about the point about counselors. So when I put in the point about counselors in inverted commas, I meant that there are two sides to it. Of course, it's a good point that you go to someone who's to a care program where there is specific interventions for mental illness. That's a good thing. Not to go to a, I mean, I'm not against people going to a local temple and having help from local healer. We'll discuss about it later. But what I meant was, but the term counselor is also frequently abused in a society like India, where anybody turns out to be a counselor. So the range of counselors is from someone in the family, an elderly person who counsels, to a religious counselor, to a person who's got political standing or social standing in the community, and probably finally a social worker or psychologist or a psychiatrist. So I just wanted to raise that point where even the term counselor can actually confuse people. Anaka, any point about how the term counselor is being used and abused in our settings?
Yes, especially in Kerala, there are so many, pseudo counselors, I must say. There are so many in the name with the board counselors in the home or in the institute. And when we go there, what they say is like some of them, I cannot say all of them belong to this category. Some of my friends have consulted counselors when they were at, you know, at most, where they were at in need of urgent help. When they visited the counselors, what they said was like, "Why did you do that?" They were so judgmental and prejudiced that they were asking them to think and work, act in a different way that against what the person is really believing. I
Thank you,
think
Anaka. I
it's
think that's a very good point that you brought about the prejudice and how people can be very judgmental where you go, isn't it?
yeah.
And I'll just address a few points here. Ashwath is saying, can you explain the term odd behavior a bit more? What I meant was as odd is that when a person behaves inappropriately, that is not according to the norms that the society prescribes or the family prescribes. So they might be having behavior which is apparently normal, like, what the society would expect, and they start showing odd behavior like being withdrawn, being laughing to oneself, being very fearful, some kind of odd behaviors. Yes, I agree that parents should have more conversations with their daughter and not get overwhelmed by the situation to know about the issue, and probably they should have conversations with people in the society who have some training or who can help them as well. Diksha, I think you also say that we liberally use the term counselor, which we have to be very careful when we use the term counselor. So Radhika says, whose counselor is a big question. Exactly what we have been saying. Yes, and Radhika agrees with Anaga as well. I'm going back to the presentation now. Can you see? Can you see my
No,
presentation?
ma'am. No, ma'am.
Okay, I have to probably do it again. One second. Can you see now?
Yeah.
All right. So I just want to summarize that usually when you look at evidence, when you look at the literature, there are barriers or challenges to help seeking which have been enumerated. And usually, like we heard what Asha spoke in the first session was usually the evidence is more on the supply side barriers. That is about the resources only. Like you will say that there is not enough psychiatrists, no enough psychologists or social workers, there's no medical medicines available in this place, there are no doctors, there's no primary care facilities. But we are looking at the other part, just like Brown just said, we are looking at the other determinants of, which impinge on the help seeking, like why people have a low help seeking inclination. Why does an individual feel a lesser need to feel that I have a mental illness or I have some behavioral issue and seek for help? And of course, we know that there's a big role of stigma and inadequate awareness, and how the beliefs of the society also impinge. I'm just summarizing that. And our own experience in this project, as well as our own clinical experience, again, also brings in negative attitudes, just like Anaga said, so much of judgment and prejudice, social and self stigma. So stigma is not only in the society but also perceived by oneself. I think in India we also have to look about lack of time and finances, where families find it very hard to take care of a person who's got a long term illness, continuously taking to a person to a professional or a mental health carer, as well as spending time on interventions as well as medication. So how else can we help these people? And of course, like somebody said, is there a counselor in the vicinity? So is there any mental health service in the rural area that they live in? Another important point, as a psychiatrist, I would also say there's a lot of misconception and perceived, people misunderstand about mental health services, about psychiatrists. There's a lot of stigma that even mental health professionals undergo, because they are seen to be some taking care of some illness which is not there, and that we ourselves go through a lot of our own fraternity in terms of mental health. Other health professionals see us as some we have to really fight for people to refer people to us. So there's a lot of stigma even about mental health services, the medications that we prescribe, thinking that this will lead into addiction, people will become become or will be always sleepy on medications that we prescribe, or they will gain weight. So there's a lot of issues that we see which will uh, influence help seeking. I also want to talk about the first point of contact. So this is one important point we have to discuss, especially this again came as a discussion point in the inaugural address, where there was a question about that. Most people go to the faith healers as a first point of contact. So there's a lot of research which has been happening on this area. So there's a lot of studies which come with different findings. Of course, in many communities, faith healers are more preferred as a first point of contact. People feel more comfortable to go to see the faith healer. But there are also some other studies which say that psychiatrists, faith healers, and general medical practitioners are equally chosen as points of contact. But the same studies also say that actually the faith healers were more expensive than the general medical practitioners, in spite of being so. People actually spend a lot of money going to the faith healers, and the reasons range from supernatural possession, unemployment, family problems, and even the treatments are usually they for solving the problems are by giving charms, amulets, by personal sacrifices, etc. So education of the decision maker and accessibility affect help seeking behavior significantly. But I'll stop sharing the slides now. I want you all to discuss these points, especially first point of, and especially about faith healers, because I saw someone ask about faith healers. So let us talk about that. Any points on faith on this? I wish we discuss here the concept of wounded healer. Do you want to talk about it, Radhika? What do you mean by wounded healer? Can you speak about it? We would love to hear what you mean by that. Can you unmute yourself and talk?
No, she's not audible. She has put a question chat.
Okay. Can you put it on chat about? No, you're not audible. Can you uh, unmute yourself? You have to click on the mute sign on your screen, on your microphone. All right. Can you just put it on chat? We can discuss once you put it on chat. We can discuss. Let me look at what Leigh Martin has put in. Due to the lack of time and finances, among other things, there's also an unrealistic expectation on behalf of the patients and clients. They expect immediate results and therefore do not commit to therapy the way they should. Why do you think that is happening, Leigh? Can you unmute yourself, Leigh?
Hello. Hello. Can you hear me?
There's a lot of noise.
One second. Is it better now?
Yeah. Can you
better.
talk about what you mean by more about that?
Usually, when it comes to Indian families, typically in a cultural context, lots of people, even when it comes to diseases or health issues aside from mental health, people tend to self-medicate more than going to a doctor or a certified physician, because they simply don't see the need to spend extra money on going to a doctor and getting their medical opinion, especially when it comes to, say, the middle or lower class families. It's almost the same thing when it comes to mental health. Like, even if people do go to a mental health professional, they expect to see immediate results. Maybe they expect them to give them medication that would show immediate results with how they feel, to help them feel better and perform better. And after a certain point in time, they would give up because things do not go the way they want them to.
Thank you, Leigh. I mean, does anybody want to comment on that? Ram, do you want to comment on that? Are you able to listen?
Oh right, yes, I could hear some of it. Yes. Well, I think that's an interesting one. There's a whole variety of reasons determining whether people seek help or don't seek help. And I've just thrown a couple of observations of my own. One of which is that often people such as spiritual healers and faith healers are attractive because they're people who are available in your community, they're people you know, they're people who've already helped you or helped family members. And what they have to say often ties in with what you and your family have believed for generations. Whereas, going to a health professional may involve going out of your community, out of your neighborhood, may involve engaging with personal and institutional systems which are unfamiliar, which are it's a bit stressful, it's a bit strange, and if you're trying to take care of your relative who's suffering as well, might be even more difficult. Another thing I've noticed if you're an informal carer for somebody in distress or disorientated or confused, sometimes if you do try and steer them towards a health professional, this can create additional conflict in that caring relationship. It can sometimes come over as a carer, an act of disloyalty, trying to palm them off on a psychiatrist or something. And sometimes as a carer, it's easier to carry on caring than it is to steer the person towards a health professional.
I agree with you.
And I think that's something I've seen.
I think that's a good point, that people want to. It's easier for them to care when it's a familiar system, and especially in our society in India, when it's to do with religion and faith, it's much more accepted, and there are clear prescribed rituals that they say you do this and everything is going to be okay. So there is this blind faith to follow that. And I'm not against that. I think faith healers are a very important first point of contact that we should actually use and enable, but we should work with them together so that we can actually bring people. So if people want to do the rituals and religious type of practices, they can do that, but we should also give them education on what else should be needed, so that we can have integrated care, respecting their wish for to have those familiar feelings of security. There is a sense of security for them there. I agree. I just
The-
wanted to say for Lee, I think Diksha is also saying, in addition to what Lee has to say, I also believe that there is a lack of awareness and people give up due to lack of commitment. The plain fact that therapy and mental health treatment takes time is somewhere still unrealized and can be attributed to various factors, one being stigma. I agree totally. I think when we say that there is a lack of commitment, or they self medicate a lot, I mean, they do that for other illnesses as well, but especially for mental health. I think it stems from especially that lack of understanding about the nature of mental illness, because often people do not realize that is what I meant as the low perceived need. People find it hard to believe that yes, I have got a mental illness, or I have got depression, I need specific medication. So that is a big step for a person to get on to. And also the objectivity that is available for other physical illness is not available for mental illness. It's very subjective. So sometimes you get better, and then people think that, oh, this is going to be good forever now. And sometimes then they get another episode. So it's very difficult for us to keep. So I think the education and our continued presence in the journey of their illness is very important. So that is why we need multiple partners while providing care, so that we can actually make that possible. When we follow very specific medical model, we lose out on the support that we get from the other people from the community. I think that's also one major main point where we lose out people, because we just rely on a medical model. What do you say, Brown? What do you think of that?
Yeah. Well, I'm very keen on trying to get people to work together so
Yeah.
that health professionals appreciate the role of traditional healers, and traditional healers are also aware of the availability of health services, mental health services, so they can kind of refer people on where it might be helpful. And I think also some of the comments that are coming up in the chat are intriguing ones. The fear of getting branded as a person with issues, the stigma. Um, Now, I suppose, don't forget, if people don't want to talk about things, it may not just be because of stigma.
Yes.
Even in very communitarian collective societies, people have a notion of privacy, and being able to control whether others know about your affairs or not and what you talk about to others is an important part of being an adult. When you're a kid, you're fair game, you're an open person, and perhaps if you're very elderly and need taking care of. But being able to manage what information other people have about you or close family members is not necessarily a bad thing. In some ways, it shows that you're coping with social life. So yes, of course, it can lead to bad things if it means that your social, marital, or educational opportunities are curtailed, of course. But
I think taking
let's
care of
not worry
all,
about it in itself. Yeah.
I think taking care of all factors, I think we should also bring in. I think it is also because in the what you call it, ethics of privacy and autonomy, and it's not very well pronounced in a society like India, like in UK probably. So people find it hard to understand that you know people need they do not want to share about what they are going through as well. So there are two sides of it when we want to say that, when we say that people do not share or people do not come out. And I think Radhika, I'll go back to one point where you said that self-care is important, and you wanted to talk about screening about mental health professionals. I think that's a tough point to discuss, where what do we screen for, and how valid these screening is going to be. What are you going to identify? That will open up a lot of discussion on should we screen mental health professionals if they want to be, if they themselves have issues? So that is, I think, a separate topic that we need to discuss about that. If mental health professionals have issues on their own, they cannot provide. That's actually people. I think generally most people have issues. So mental health professionals will also have issues. It's it depends on the impairment that you have and how much you can reach out to help others. So that's, I think, we cannot probably discuss that now. I'm going on to the next point. We will talk. I'll mail to you, Radhika, about it if I get your email ID. So another point which has come out is,
I have a question about tradition.
yeah, Ramya.
Yeah, I have a question about traditional healers. I was wondering, is there a model being implemented anywhere in India
Yes,
where mental health professionals are collaborating with traditional
yes,
healers?
yes. There's a lot of evidence, especially I think Sangat. There's a lot of studies which has come from North India, especially Madhya Pradesh, where community programs and research programs where faith healers were part of the program of providing. I can send you, if you just Anaga, if you can find out the email IDs of Radhika, where I can send something about screening of mental health professionals. And of course, Ramya, I can send her some studies where this has been done. Ramya, there has been instances and even research projects where faith healers have been collaborating to provide uh, mental health care. And in my own experience, I can tell you, I work in Kerala, and we have a program in Chotanikara, which is a temple where it is famous for people with mental illness. People come there for treatment, and they stay there for months undergoing, they get a lot of rituals, praying, all those things, bhajans and all those things. So we have a system where they know that we run a clinic and people are referred, so they continue that as well. It's not a formal system, but because the community knows that there is a mental health service, community mental health service right there beside the temple, the people are also referred to the mental health service. So there is a collaboration, though not formal. I'll just go to the next
Thank
question.
you.
Thanks, Ramya. So, Ketika,
Ma'am,
I think the mistress of, are we looking?
ma'am.
I think we have 5 minutes.
Yeah, yes.
I'll just go through Ketaki's question. I think the mistrust of mental health professionals is understandable, considering that some practitioners are unethical or, as previously discussed, pseudo counselors. I agree totally. The prescriptions, everything are very difficult. Okay, I think are we supposed to stop now, Anaka?
No, ma'am. The next sessions start only at 6:50, so it would be great if we can wind up at
I'll
6:45.
take 5 more minutes. I agree.
Yeah.
All in all, it tends to be seen a very unattractive option as compared to healers. It's almost like getting professional help is a privilege more than a necessity. It is because access is also poor. We are talking about the whole of India, where majority live below poverty line. Lee. So access to specialized services like counselors, psychologists, social workers is probably unheard of in rural India. Probably what you would get is probably a psychiatrist or a primary healthcare doctor who can help, or a health inspector or someone who they can access. Please send your email IDs to Anaga so that I can send you some participants. I just want to bring one more uh, question for discussion, and then we can probably stop. I'm sorry that we cannot uh, do all of it. So I just brought in some statements for discussion and theories on help seeking, which you can read about. I want to talk about this point also. What do you think of influence on behavior, especially help seeking from a performer on media or celebrity? For example, Deepika Padukone coming out open on depression and taking a strong role in advocacy. I want to talk about this because right now we are also using tele platforms so much, and social media is used so much these days. So I just want to know what your thoughts on also how the influence on behavior is when a media personality, like we had the same conference last week where a film actress from Malayalam uh, films came out openly to talk about her own um, issues with emotional distress. So I just want you all to bring up points how this influences the behavior on help seeking, which I think is very important in this current scenario, especially with the pandemic and all those things. All the participants are requested to join main stage right after the workshop. True, the ultimate aim is to heal and works. Any thoughts on this? Do you want to chat on this? It's okay that celebrities open up, will show that what we see is in screen and social media is not rosy, which is true. Yeah, I think um, there is also evidence. This is called the parasocial interaction, actually. Literature calls this as parasocial interaction, where when a performer or someone who is visible to the society, like an actress or a media celebrity, comes out and talks about something like this, the individual who watches this actually identifies with the person much more, and it is almost like a psychological experience where they identify with their issues similar to the performer's issues, and that influences the behavior. There is evidence, and I can send some articles on parasocial interaction as well. What I want to say is that this is not only a social media or a behavior of a celebrity, this also has influence on help seeking, and many people in the West also have taken up on, and we could see a lot in the recent Olympics also, where people came out and talked about their mental health issues, and there was a lot of discussion of mental health. And with the COVID-19 pandemic also, there's been a lot of issues. So Ketiki says, I have worked with the Live, Love, Laugh Foundation previously and have found that students often resonate with celebrity stories, which is good. Yeah, that's a good point, Ketiki. They often expect fame and success to be equal. Mental wellness, which can be challenged. So people ask, how can Deepika Padukone can have depression when she is blessed with beauty, she's blessed with money, she's got all the films in the world. So that is a good way of when Deepika says that nothing mattered to me, but I did have the illness. So that's a good way of saying that it is not only the things happening around you. It is also something happening within. So giving you another perspective about mental illness. Brown, do you want to say something on that?
Yes, just very finally, it's certainly, if a celebrity says, I've struggled with depression or I've struggled with drink or drug problems, other people struggling with similar things may feel less alone. It may normalize disclosure, talking about it, doing something about the problem. Here in the United Kingdom, I do worry sometimes that celebrities draw upon this just to try and make themselves sound more interesting and make sure that they still remain in the public eye a little. And also, don't forget, particularly a celebrity who's doing very well for themselves and making loads of money, their experience will probably be very different from that of people on low incomes. The resources that they can access, the ability to pay for expensive private therapy and private clinic stays, most of that will remain far beyond our reach. So in some cases it can be helpful, but equally, I do have one or two reservations.
Yeah, I do agree, because this is also like, there could be it's always a balance, isn't it, between two perspectives. But this person that I spoke about, Brown, she also has started a non-profit organization, and she's working in rural India for education, for bringing out awareness. And she's a person who also looks into the broader dimensions of mental illness, like the socio-cultural beliefs, the rural attributes of mental illness. So, and that's why I brought in that point. So I think we'll stop now, because we don't have time. Thank you for the discussion. It was quite interesting. So Lee says the downside is that there is an increasing amount of people using mental illness as a fashion statement, so as to say, to excuse out of norm behavior. That's exactly what Brown said. True, I agree totally. What I also wanted to point out that there is scientific evidence to it. So we need to look at it. Every point that we raise has two or three or multiple perspectives to it. So I was just bringing in certain perspectives that we need to think about before we kind of act on it. Thank you so much for the good interaction. I hope we had some learning points as well. Thank you, Brown, for your presence.
Thank you.
Thanks, everyone. Thanks, Anada.
Thank you all.